One of them is that it's only for old people. It's only for people that are 70 and above. And indeed, that was the case in the 80s. But now with the plastic that's used in the joint replacement being much longer lasting, and for the last 20 years, going down to age 40 is not that unusual. They still need to have severe problem for a joint replacement to be a good idea, but age is not held against patients. So there's some elderly patients into their 90s that are healthy that would be a candidate for a joint replacement, and some patients as young as 40 for a hip or knee replacement, occasionally even younger than that. I think another misconception is that you have to be nice to your joint and baby it and don't go back to activities. I have a number of patients that like to play tennis or like to walk the golf course, and part of the reason that they had the surgery in the first place was so they could return or continue to play their sport. And we encourage patients, I don't want someone running 5 miles a day, but for someone that wants to play tennis or golf or other activities that are sports, that's part of the reason that they had the joint. And I encourage them to go back to trying to stay healthy and be as active as they can.